Hello, everyone. This is Saima at Holistic Happiness Academy, and today's session or video is about the narcissist's need to be better than everyone else. We all have, to some degree, a need to be better than other people, and this is a need to be superior. In Adlerian psychology, this is a motivation for children to become who they become and to take on certain patterns because of their birth order. But here in this video, I'm going to be talking about this need to be superior. It's so intense and it's so toxic rooted that the narcissist cannot survive without that hit, so of being better than other people. They're the best, and they also have a very strong sense of being the victim along with that. They're very driven to achieve, and can be very perfectionistic as well. Sometimes narcissistic people rise to the top. They rise to the top of their profession, whether it's in a corporate profession or whichever profession they take up. And there are strong narcissistic traits in them, and they want to be the best. But this desire to be the best, it's not just, you know, um, a healthy desire. It crosses the boundary from being a healthy desire to a dysfunctional desire, because if they ever fail or they do something that doesn't keep them at the top, it can be soul destroying for them. They have an extreme need to be the best. And this high need for perfection, you know um, and I'm now talking about narcissistic people who are kind of more what we would call better adjusted, better adapted, but still, despite their seeming mask of being more well adapted to society, there's an extreme need to be the best, to be superior. And it's such a strong need that they can get extremely dysregulated, meaning they can get very mad, very rageful, very angry if it appears to them that they are not the best. And you may remember that story of Snow White's stepmother, who looks in the mirror and the mirror says that she is not the best, she's not the most beautiful, and that there's Snow White who is more beautiful than the stepmother. And that destroys the stepmother's ego to such an extent that she goes out and tries to get the girl killed. And so she does something criminal because it is so painful for her ego to realize that she is not the most, beautiful woman. Now, why is it so painful for narcissists to be second best? Why is it that they must need to be the best in order to cope with life? Why is it that they lose it, as it were, if they're not the best, or not considered the best, or somebody else takes their place? And that goes back into the heart of the disorder itself. We're talking about a personality that is disordered. There is a problem, and if there is an emotional problem, so they may be wonderful, perfect, in every way as human beings, but deep down inside there is an intense trauma and intense insecurity, due to which they go to great lengths to achieve their position in life. Now, narcissism is not just, for that person who has the disorder. It's a disorder if the emotions are so dysregulated that the person can do anything in order to get what they want. But I am going to talk about narcissism as a general rule as well, that there is that attachment to, narcissistic ideas. in the sense, that sense of, egocentrism, that you're the only person here, you're the most important person here, your story matters more than other people. So that goes back to a developmental stage. And that development stage is between the ages of 2 to 4, where the child is very, very self absorbed, very strongly fixated on their own needs and whatever they want. This is also the no stage. This is when they're not cooperative. And then we move a bit fast forward and we can see the stage appearing again at the age between 12 to 17 in teenagers, where they are very fixated on their own worldview and cannot appreciate anyone else's. And these are important stages in development of the brain. And so this is the time, if children are not provided the correct care in those formative moments, children can get stuck in that place, and they may be looking for other people to supply them with what they needed at that stage, which could be unconditional love, it could be attention, it could be a sense of direction, maybe. So sometimes these are the critical ages at which life changing events are happening. For small children, from toddlers, this is when another child is born. And so their attention, and there's a competitor for their attention. And then at the later stages and the teenage years, this is the time when they are forming strong ideas about who they are and their identity. So if there is a lot of opposition, it is because they're trying to differentiate themselves from the rest of the family and form their own individual identity. So they start to push back. They start to become very, dysregulated. They may actually exhibit a lot of anger and rage because they're trying to be their own person rather than meet the expectations of the parents all the time. And so that can often be a cause for trauma for both, for the teenager. And these are again important moments where the parents really need to understand what to do with their child. So in this little video, uh, much like at different stages there is narcissism that comes up in many mental health disorders. There is strong aspects of narcissism. If somebody has a psychotic disorder, they will always have some degree of narcissism. They'll be very self-absorbed, and they will not lack empathy. They will lack, emotional regulation. They may be crying all the time. They may be very self-absorbed. So there are other mental health disorders where you can see some of the pathology of emotional dysregulation, such as borderline personality disorder, which is actually quite common as well. And so, what is something that parents can take away? So, say you have a teenager who's acting out, and they're angry for no reason, and they are not, communicating well with you. The teenager has a lot of conflicting emotions about who they are. This is their life stage where they're very confused about themselves and their direction and their identity. So there is that inherited identity that they're getting from the parents, what the parents say about them. So that's very critical. What you say about your child at that age is very, very critical for how the child, the teenage child, perceives himself or herself. So be careful, what you say. Be careful with what kind of negative words you use about them, because that's how they're going to treat themselves. Narcissistic people lack self love. So, that 2 year old child who was replaced by someone else, somewhere along the line, that 2 year old child blames themselves for, for that. The trauma is inside them. They've become identified with the trauma, probably. And that is why they are behaving like that, is because they become that. And so it's traumatic when a teenager loses their cool and they're very angry and they're very upset. And if the parent pushes back with equal amounts of anger and equal amount of, anger energy back at them, that's going to just blow things out of proportion, because in any case the teenager is struggling to self-regulate this, and so when another adult also displays the same sort of adolescent behavior, that's not going to help them at all. It's in fact going to make it harder for the teenager to find calm and the ability to regulate themselves. So what's the number one tasks of parenting? I would say number one task of parenting is to help your children to self regulate their emotions. Find a way to calm themselves down, to get themselves out of those extreme, intense emotions into something calmer. And the way to do it is to be present with the emotion, but understand that the emotion is going to pass, it's going to finish, it's not going to be there forever. And to just let the child or the teenager know that they will be feeling better in a little while. And just to acknowledge that, they're not feeling so good. And to just help them recognize that what it is a feeling, it's not a fact in the world. And these are again ways in which we can help children to identify reality versus emotion versus behavior. And so this is something that parents can do, is to help their child find calm by saying, by acknowledging what the child is feeling. It looks like you're angry. Are you feeling angry right now? And then just helping them find a way to calm down, and just to ask them. Many times it gets as simple as just asking, do you need to be in your room for a little while until you feel better? Are you feeling awful right now? And to have those feeling words available as a resource for you and the child, rather than the feeling being, shared by both of you. So we're coming to an important point, which is about enmeshing yourself with the child versus allowing the child to feel their feelings and being supportive of what is going on with the child without enmeshing yourself. So if you are able to do that, then there is a natural emotional boundary between you and the child. So the child's feelings are not your problem. You are witnessing them, you are giving empathy to them because they're feeling something. And that itself can be so empowering for your child. Every time we send out compassion or empathy towards somebody, they learn something. They're able to let go of a toxic feeling and they're able to move forward. So, anyway, just a few bits of advice on what's going on in the narcissist's mind. Likely, this is again very likely, and I'm not talking about people with narcissistic personality disorder here, but just people who are very self absorbed and unable to calm down, like dysregulated, which is a core feature of narcissism. Thank you. Bye now.